Hello, my name's Sophie Hasty and I'm the Parent Education Midwife at Swift. Welcome to the Path to Parenthood, Preparation for Parenthood. So this session is all about feeding and living with your baby. I hope you enjoy it. The situation, guidance and information around COVID-19 is changing all the time. Please check out the Maternity Updates Swift page on Facebook for the latest information and guidance and policies from Swift. This session, Preparation for Parenthood, will cover feeding your baby, living with the baby, becoming parents and the transition to parenthood, your baby's brain development, and keeping your baby safe. Pregnancy is a really exciting time. You are creating a new human being. Try to take some time out every day to connect with your baby. Visualise your baby. Think about names for your baby. Respond to their movements, stroke your bump and talk to your baby. Encourage your partner and any older children to get involved with this. Some partners may need some encouragement to start with, but this becomes easier once they can feel your baby move through your tummy. Doing this helps you build a relationship with your baby so that when your baby is born, you already have a strong bond and connection with them. Think about how you will care for your baby. Babies like to be cuddled and held. In your womb, your baby is in quite a noisy environment with constant motion. Your baby can hear the blood pumping round your body, your tummy rumbling and the constant motion of your breathing. After they are born, they often get very upset if they are put down, and they are calmed by a feed or a cuddle. It is not good for babies to be left to cry. Make a plan of how you will manage this, especially at night. It is up to you how you feed your baby. It's a very personal decision. We will support you as much as possible whatever you do, and there is no need to decide until you meet your baby. But we do need to give you the most up-to-date information about feeding so that you can make an informed decision about how you feed your baby. Breastfeeding is more than just about food. It is a continuation of the close relationship between you and your baby which you begin in pregnancy and which ensures that you both get maximum doses of hormones, especially the love hormone oxytocin. This helps your baby's brain develop and helps you fall in love with your baby and adapt to motherhood. Your milk will change according to your baby's needs on a day-to-day basis. It is full of special elements which will help your baby grow. We have known for many years that babies who receive breast milk are less vulnerable to infections, and new research is helping us understand that friendly bacteria in breast milk protects a baby's gut, and this helps the baby's immune system get off to a flying start. Your milk is full of antibodies to bugs in the environment. An example of this would be when a mum kisses her baby, she is exposed to any bacteria on her baby's skin. Her body quickly makes antibodies to these specific bacteria, which are then incorporated into her milk and then swallowed by her baby, thus protecting her baby from the bacteria on their own face. So kissing your baby is very beneficial. Breastfed babies are 5 times less likely to need to go to hospital for an upset tummy or suffer from a urine infection. They have half the likelihood to suffer from ear infections, allergies, diabetes or obesity. And there is also evidence they are less likely to suffer from childhood cancers or heart disease when they're older. This graphic demonstrates how antibodies are incorporated into breast milk. If a mum is exposed to any bugs in the environment, her body will naturally make antibodies to that bug. It could be a virus, like coronavirus, or a bacteria. The antibodies are sent to the breasts and included into the breast milk and then swallowed by the baby, thus protecting the baby from that bug. So, while we are also worried about COVID-19, it is even more important that babies are breastfed, as it actively keeps them safe. There are significant benefits to mums of breastfeeding too. Breastfeeding burns around 500 calories a day. That'll really help you burn off some of the weight you may have gained in pregnancy. According to UNICEF, formula feeding costs up to about £700 a year if you use powder, or £1,600 if you use premix formula, which is a great deal more than you would spend on feeding yourself 500 extra calories. It's also really convenient. It is on tap whenever you want it. No preparation required, so no fuss or faff. And this is a huge benefit in the middle of the night or when you're going out. You don't need to take anything with you. No bottles, no water. You don't have to worry about boiling the kettle. There are health benefits for mums too. It reduces the risk of premenopausal breast and ovarian cancer, heart disease, and possibly hip fractures in later life. So long as you and your baby are both well, have skin-to-skin contact with your baby straight after birth. This is when your baby is placed face down straight onto your bare tummy, with their length running down the length of your body. Allow your baby to stay in this position for at least an hour. During that time, most babies will crawl up your belly to find your breast and will attach themselves to your breast themselves. Let your baby feed for as long as they wish and keep them skin to skin with you for at least an hour. All babies have the natural instinct to breastfeed, just like other baby mammals. They go through a progressive process, and if this process is interrupted, they have to start it again from the beginning. The midwife will want to weigh and check your baby, and you will want to know your baby's weight. Ask her to weigh the baby as soon as possible after birth, or wait for at least an hour so you can have uninterrupted skin to skin and feed your baby. If it's done in the middle of the skin to skin hour, your baby will go back to the beginning of the process of breast crawl and have to start from the very beginning. I highly recommend the video Breastfeeding in the First Hours on the website Global Health Media for a beautiful depiction of a baby going through this process. I will post the link with the presentation. After your baby is born, make sure one of the midwives has watched you feed your baby, even if it's not your first baby and you have breastfed before. Every baby's different. Ask them to make sure that you are holding your baby right and that your baby has enough breast inside its mouth. Coming up are some videos which show you how to attach your baby onto the breast and how to hold your baby. We call this attachment and positioning.
Hi, my name's Sophie Hasty and I'm the Parent Education Midwife at Swift, also known as Warwick Hospital. In the last couple of slides I've talked quite a lot about attaching your baby to the breast and the importance of your baby getting a good attachment with lots of breast in the mouth and the nipple right towards the back of the mouth and against the soft palate. Now I'm going to show you some of the positions you can use to hold your baby to achieve that good attachment. So it's really important that you're sitting comfortably. Often an upright chair is really good, but something with good back support when your feet can really touch the ground. And it's worth using a footstool if you need to and going to quite a bit of effort to getting that position of yourself right before you start feeding your baby, because you're going to have to maintain it for quite a long time. So I'm sitting in quite an upright dining style chair, which is good, but also a slightly more reclining chair can be fine, so long as you're supported and you're comfortable. So there's a few principles. Here's my baby. This is Maisie. It's quite important that there's a few principles to remember when you are attaching your baby at the breast and positioning your baby. So you want to have your baby close to you at all times, so the whole body close to you. You want the body to be in a straight line so that baby doesn't have to turn their head to get to your breast. Imagine eating yourself or having a drink with your head turned that way. You wouldn't do it, would you? So why do you think your baby would want to do it? So try not to do that, so your baby has to turn their head. You want the body in a straight line. Baby's head needs to be free. It needs to be able to drop back. So don't put your hand on your baby's head. Put your hand behind the shoulders. And because baby's head needs to drop back, if the chin's tucked in, you would aim your baby's nose at your nipple, not your mouth at your nipple, because you want the head to drop back to reach your nipple. So nose to nipple, and it needs to be sustainable, so you need to be able to maintain the position for quite a long time. So I think one of the best positions, especially in the early days when you and your baby are learning how to breastfeed, is this position, which is called the cross cradle position. So you've got your baby across your body, the arms are open so they're not in between you and getting in the way, so they're open so your bodies can be really close. Put your hand behind your baby's shoulders so that the head can drop back. And if I turn this way so you can see, tuck your baby's bottom under your elbow like that, so that it stays really close to you and you've got control of your baby, because that really helps, because they're wriggly things. So with your hand behind your baby's shoulders, maybe slightly into the nape of the neck, just bring your baby to your nipple. Let's see if I can get a bit closer here. And tease your baby's lips with your nipple. You're moving your baby, not your breast. Tease your baby's lips. Which way am I going there? Like that. Until your baby does a really big, wide, gapy mouth, just like a baby bird in the nest. You know, you see on Springwatch when the mummy blue tit comes into the nest box and all the babies go, ah. That's exactly the mouth you're waiting for with your baby. So when your baby does that big, wide gape, it's not a cry. It's a bit like a yawn, but not quite. It's a gape. When your baby does the gape, straight on your breast. Now that's a really brisk move. It's really assertive. You're the boss here. Don't sort of fiddle and faff with it. Don't be frightened of hurting your baby. You're not going to hurt your baby. They're pretty robust. So a really brisk move straight onto your breast. And then when you're happy your baby is on, you can bring that arm round your baby and then settle your baby with their head in the crook of your elbow, and then you've got this arm free for your drink, for your phone, for your TV remote, your book, whatever. And then make sure you're sitting comfortably, sit back, and you can stay there for quite a long time. You can use pillows on your lap, but for actually getting your baby on, they probably get in the way. So try not to be too dependent on pillows. Just hold your baby, and then once your baby's on, if you want to put a cushion there to take the weight a bit, that's fine. But to be honest, it's easier without too many cushions, especially those big V cushions. So that's the cross cradle position. Another really useful position is the rugby ball position, which is the underarm position. So that would be coming to this side, tuck your baby under your arm, hand behind the shoulders again, and again you move your baby over your nipple this way until they do the big wide gape, and then straight on your breast, and then keep your baby's bottom tucked in. You should be able to see the top lip, and the nose should be clear. There should be more areola visible above the top lip than there is below. Actually, there's often quite a lot of areola visible above the top lip. Chin tucked in. Baby's cheeks should be nice and full and round. There shouldn't be any indenting into your baby's cheeks as they suck. So the first few sucks of a feed will be quite deep and quick, but then as the feed settles out, they will lengthen out. There can be quite often pauses between the sucks, so they can do suck, 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 pause, suck, 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 pause. The pauses are normal, it's fine. So as your oxytocin starts to flow, the milk will come out of its own accord, so your baby's not having to work that hard. Lots of mums will describe a feeling of release in their breasts after a minute or two of feeding, and that's what we call the letdown reflex. And that's when the milk is just flowing on its own and it's easy then. So that's the rugby ball position. Another really good position is the semi-recumbent position, or it's also called biological nurturing. So if you slide your bottom to the edge of the chair, make sure you've got cushions under your back, or you're resting on the bed with pillows behind you, so you're comfortable. Let your baby be down the length of your body. Point nose to nipple so they have to tip their head back, and let them just find the breast themselves. And some babies really like this, especially if they're not particularly easy to get on the breast. And it's also, if you're tired, it's a very nice resting position. It's worth varying the position that your baby feeds in, because your baby will clear the milk out of your breast most effectively from the part of the breast nearest your baby's bottom jaw. So if you always feed this way, you'll clear the milk out of this part of the breast. Whereas if you turn your baby round, you'll clear the milk from this part of the breast, and this way from the bottom of your breast. If you get blocked parts of the breast, you'll get lumpy areas in the breast, and if they're not cleared out, that can lead to an infection called mastitis. So it is really worth moving your baby around, changing your position so you're clearing out the breast in every direction. If you get lumps in this top part of the breast, which are less common, you could feed your baby lying on your side with his head. This is a bit awkward, to be honest, but with his lying on your side facing each other with his legs up round your head. Not practical, but if you are very engorged over the top of your breast, it's worth doing just to clear that out. Let me check my list. So I've said during a feed, the nose should be free, the baby's cheeks should be full, they should stay put, so they shouldn't be coming on and off and fussing. That would suggest that your baby wasn't on properly. It can be the first minute or so of a feed, especially in the first week or so, can be quite sore. But that pain should decrease after a period of time and resolve. If it doesn't, take your baby off and start again. To get your baby off, just try and slip your little finger inside their mouth to break the seal, and then your baby will come off. If you just pull your baby away, they're going to stretch your nipple, and that really hurts, so don't do that. So your baby should be close, the head should be free, your baby's body should be fully in line, nose to nipple, and it should be sustainable. So that's close, head free, in line, nose to nipple, and sustainable. And that's the basic principles of attaching and positioning your baby on your breast. I really hope you found that helpful. There's more information about breastfeeding coming up in the next few slides, and I hope you've enjoyed watching. Thank you. Hi, Sophie again here. I'm lying down now because I want to show you the position that you can use if you want to feed lying down. This is a really useful position to use at night if you have a baby that wants to feed all night. Word of caution about this position, we don't recommend that you fall asleep with your baby in bed with you, because we know it's more dangerous in terms of risk of cot death. So if you have a baby in your next to me crib beside the bed, and when your baby wants to feed, just pull them into bed with you and you can feed in this position, and then when they've finished feeding, put them back in the crib and try not to fall asleep when you are feeding. It's definitely not a position that you should use if you are a smoker or you've had any alcohol to drink, or you're excessively tired. But maybe if you wanted to use it and you were worried, you could ask your partner to sit and watch you, so could sort of supervise you feeding in this position. So the way to get your baby on in this position is to lie fully on your side with your head well supported by pillows, but your shoulder should be on the bed, so you don't want your shoulder to be on the pillows. You need to not be so much on your side that your bottom breast is buried into the bed, sort of so slightly tilted back, and your baby lying on their side next to you. And your baby needs to be fully on their side. And hand behind the shoulders, point the nose to the nipple so that the baby has to tip their head back, wait for the big wide gape, and then bring your baby onto your breast. All the same principles of good positioning and attachment apply, but in a horizontal position. And if your baby wants to feed a lot at night, being horizontal is very nice. In the last video I mentioned the feeding this way round if you had lumpy areas in the top of your breast, and this is a very awkward position but could be used in that situation. So this bottom arm, you'd need your bottom arm to go right out above your head so it's out of the way, and have your baby that way round. And you would almost certainly need your partner to help you get your baby on in this position. But if you've got those engorged areas or those lumpy areas, it's worth a go. Okay, so I hope you find that helpful and maybe had a laugh at me lying on the bed. Thank you.
Bring the baby's nose directly opposite the nipple. Let his head tip back a little so his top lip can brush against your nipple. This should make him open his mouth. When his mouth is wide open, he will take the breast with his head back and chin leading. The baby can then take in a large mouthful of breast, not just the nipple. The breast will be drawn deep into his mouth, so your nipple will go all the way back to the soft part of his mouth, and you won't get sore. So, once your baby's head has tipped back, your nipple will brush his top lip. Wait for the wide gape. Then bring your baby to the breast, chin leading. In this position, feeding will be comfortable and your baby will be able to take all the milk he needs.
I highly recommend a series of videos on a website called Global Health Media. They have a number of videos that are all aimed at mums. There are some aimed at health professionals too, but the ones aimed for mothers are probably the best for you. Particularly good is attaching your baby at the breast and positions for breastfeeding and breastfeeding in the first hours, though there are many others that you can explore. I will post a link to the website with this video. Do you remember what I said about oxytocin in the previous videos? Oxytocin is the love hormone. It has an important role in birth and also in breastfeeding and baby brain development. Oxytocin likes a calm, safe environment, so feeling secure and relaxed is very beneficial to breastfeeding. When your nipples are stimulated, your brain releases oxytocin, and that stimulates your breasts to release milk. So when your baby suckles at your breast, after a few minutes the milk flows automatically. There is oxytocin in your milk, so your baby drinks this. Your baby will release their own oxytocin when they are being cuddled or receiving closeness, comfort and love from their parents. All this oxytocin bathes babies' brains, and that helps the brain to grow and mature. The more you cuddle your baby, the better. You cannot over-cuddle your baby. Cortisol is a stress hormone, and it could be described as the reverse of oxytocin. When a baby gets stressed or upset, they release cortisol, and this slows down the formation of connections in the baby's brain, which makes it harder for the baby to make strong bonds. Babies are more likely to get stressed if they are with people other than their parents, so try to avoid letting too many people hold your baby. This would be for their benefit, not your baby's. If your baby is upset and they do not want to feed or need to be changed, just give them a cuddle. You will not spoil them or make a rod for your own back. You are providing them with a nurturing, loving environment and helping their brain to develop. You cannot cuddle your baby too much. This graphic demonstrates the oxytocin-cortisol effect on the baby's brain. The oxytocin is like a watering can, watering fertiliser onto the brain, whereas the cortisol is like a pair of secateurs, cutting back brain growth. It is recommended that you feed your baby responsively. This means that you feed your baby whenever your baby shows that they want to feed, or when you want to feed your baby. Breastfeeding is not just for nutrition, but also for love, comfort and reassurance between you and your baby. Your baby is showing that they want to feed when they suck their hands, wriggle, move about or root. Rooting is when they turn their mouth to an object and try to suck onto it. They will do this to almost anything that comes within reach of their face, your nose, your chin, your chest, as well as your breast. Feeding at this stage is ideal, as baby is still calm and will attach to the breast effectively. Crying is the last sign of hunger, and by the time your baby is crying, they may be too distressed to feed. If this happens, try to calm your baby down by giving them a cuddle, having skin to skin, offering them a finger to suck, talking to them or stroking them, and then try again to feed them. Responsive feeding is also feeding when it works for you, just before you go to bed or go out, for example. Breastfeeds can be long or short and at varying times of the day, depending on why you and your baby have decided to feed. Your baby cannot be overfed or spoilt by too much feeding, and as you get used to it, breastfeeding should not tire you any more than the normal tiredness that all new mothers feel. Feeds can be very variable in length. In the first few days after birth, you will have very small amounts of fluid called colostrum in your breasts. This is highly nutritious and full of antibodies. Your baby will get about a teaspoon of colostrum per feed at this stage. As your baby suckles, hormones travel from your breasts to your brain and back to your breasts, which stimulates your breasts to make milk. The more your baby suckles, the more milk you will make, so it is vital that you let your baby feed as often and for as long as they want. At this stage, many babies will feed for prolonged periods. Try to go with the flow of this. Around day 3 or 4, your milk will come in. Your breasts will become larger and fuller. Often the feeds will shorten and the space between them will lengthen. We expect babies to feed at least 8 times in 24 hours for between 10 and 45 minutes. Many parents get very anxious about whether or not their baby is getting enough milk. Every baby is different, so don't compare your baby to anyone else's. Some babies will only feed 3 times in the first 24 hours, others much more frequently. After that, it will become more often. After a feed, your baby should come off the breast spontaneously and appear content. Often they will look quite drunk, just like the baby in this picture. If they are feeding constantly and never seem satisfied, that could be a sign that they are not getting enough milk. The content of their nappies will tell you a lot too. I'll talk a bit more about this in a minute. Your baby's weight will tell us a lot. We weigh your baby at birth and then on day 5 and day 10. We expect babies to lose some weight in the first few days, and they are designed to cope with this. They have plenty of fat reserves to compensate for it. If we are worried about your baby, we may weigh more frequently. The content of the nappy is key. If it is coming out of the bottom, it must be going in at the top. The picture at the bottom demonstrates the size of your baby's tummy at birth, 3 days, 1 week and 2 weeks. Even at 2 weeks old, it is only the size of an egg. So don't worry about your baby not getting enough milk. Its tummy is designed to only need fairly small amounts, and your breast milk is very highly nutritious and it is enough for your baby. On day 1 and 2, you should expect about 2 wees a day and at least 1 poo, and the poo will be black. The black poo is called meconium. On day 3 and 4, there should be at least 3 wees a day and 2 poos, and the poo should be beginning to change. It will go sort of through black, green and end up yellow. As the poo goes yellow, that tells you that there is milk all the way through your baby's gut, and therefore your baby is feeding really well. On day 5 or 6, you should have at least 5 wees and 2 poos. The poos should be around the size of a £2 coin. Day 7 onwards, about 6 wees should continue, 2 poos, and the poo should remain yellow. Breastfed baby's poo will be quite yellow and sloppy with sort of seeds inside. They look a bit like mustard seeds. So breastfed baby poo looks a bit like a korma curry. Bottle-fed baby's poo is a bit more solid and a little bit browner. In the first couple of days, you may see some red deposits in your baby's nappy. These are salts that are being flushed out of your baby's kidney. They're completely normal so long as they're only once or twice and on day 1 or 2. If they're more frequent or when your baby is older, speak to the midwife because it can be a sign that your baby is dehydrated. Baby girls sometimes have a little bit of blood in their nappy or some mucus. This is vaginal discharge and it's completely normal. It will go away. She's having it because she's received hormones through the placenta from you during your pregnancy. When you first start breastfeeding, your nipples may feel tender, but they shouldn't get cracked. I talked a lot earlier about attachment and positioning, so make sure your attachment and positioning is good, and that will prevent you getting sore nipples or cracked nipples. If you do get cracked nipples, use some nipple cream because that will help keep them moist. It's a bit like putting lip salves on chapped lips. Try and find one that is pure lanolin. That's usually the best. Ask one of the midwives to watch you feed and see if she can suggest any alterations to your positioning or your attachment. Your milk will come in 3 or 4 days after your baby is born. When this happens, your breasts will become fuller and heavier. Sometimes women get too much milk and their breasts become very tight and hard and painful. If this happens, keep feeding your baby responsively and encourage your baby to feed as much as possible. It is best to avoid expressing too much milk off your breasts to ease them, because this just gives your breasts more stimulation and encourages them to continue to make too much milk. If you need it to express, just to soften them up so your baby can get on, use hand expression, and I'll talk about that in a little while. Hot soaks on your breasts can help open the vessels and therefore the milk will come out more easily. You can do this with a flannel or in the shower or the bath. Cold soaks are also very comforting. You can use a cold flannel. Some women like to use cabbage leaves on their breasts. It's best to use a Savoy cabbage, which is the dark green crinkly kind of cabbage. Keep it in the fridge, take 1 leaf off at a time and put it inside your bra. There's no empirical evidence that this is helpful, but anecdotally many women report that it's really soothing and it makes their breasts more comfortable, and it certainly does no harm. Many new parents worry that their baby isn't getting enough milk or their baby is reluctant to feed. This can be quite a complicated and complex situation, so if you think your baby isn't feeding properly or getting enough milk, please talk to your midwife and she will make an assessment and a personal care plan for you and your baby. Things you can do to encourage your baby to feed if they do seem reluctant is try skin to skin and stimulating them by tickling their toes, stroking their cheek and trying to wake them up. But if you are worried at all, please give us a call and we will make a personal assessment of you and your baby. This diagram shows the anatomy of the breast. I think it's useful to have an understanding of the anatomy because it helps you understand why some problems might occur. The breast has lots of grape-like structures, which are called lobules, also known as lobes, and this is where the milk is made and stored. Each lobe has a tube that comes out through the nipple, and this tube is called a duct. It's really important that the milk is cleared out of every duct because otherwise the milk can back up in the lobule and this can cause an infection, and that's mastitis. The best way to make sure each duct is cleared or emptied is to change the position that you hold your baby in for feeding. So use some of the different positions that I showed you in the video earlier. Your baby will clear the duct most effectively nearest to their bottom jaw. So if you change the position of your baby, you're changing where their bottom jaw is. If you get any hard, lumpy or red areas in your breast, that may be due to a blocked duct. You can clear this by using hot flannels on that area and changing your baby's position. If this doesn't work quickly or easily, or you have any problems at all with your breasts during feeding, it's absolutely essential that you speak to a midwife and ask for some personal support and advice on how to avoid mastitis and clear your ducts. Sometimes women decide to express their milk, and there's two methods that you can use to do this. You can use hand expressing or pump expressing. In the early days, hand expressing is more effective because the quantities are small. But in the longer term, with larger quantities of milk, a pump is more effective. People decide to do this for a number of reasons. A few women decide they don't want to breastfeed and they want to bottle feed. But if they can express, they can give their babies breast milk in a bottle, and that means the baby still gets the benefit of breast milk. Coming up is a short video on how to hand express, and then I will talk a little more about pumps.
Hi, Sophie here again. So I'm going to show you in this video how to hand express your milk. You might need to do that if your baby is reluctant to feed or if your baby is in special care. And it's very useful in the first couple of days after your baby's born because the amounts of milk that you might get will be very small. So if you try to use a pump, then you may lose some of the milk in the mechanism of the pump. So I have my handy knitted breast here to demonstrate this with. So the first thing to do is make sure you're feeling warm, relaxed and safe. Because if you're feeling anxious or uncomfortable, then your oxytocin won't flow and that means your milk won't flow. If you're separated from your baby, maybe have a photograph of your baby handy or something that smells of your baby because that will also help your milk to come because the oxytocin will flow better. So start out with massaging your breast, just running your hand down your breast all over and then maybe kneading it a little from the area nearest to your chest to the outer aspect of your breast. It might help to put a warm flannel over your breast and that will help the vessels and the ducts to open up and dilate and that will help the milk to flow. So put your hand around your breast just back from your areola. If you remember the diagram in the last slide, that showed you that the lobes where the milk is made and stored, then the ducts, then the nipple. You want your hand around the back of the ducts, so that's around the back of the areola. And you make your hand into a C shape, like that, that goes around your breast. And you squeeze and relax, and squeeze and relax, and squeeze and relax. And keep going in that one area until the milk stops flowing. It may take a few squeezes to get anything, and it will appear like tiny beads of milk on your nipple, and if you're using a syringe you can suck those up with the syringe or let them drop into a sterilised cup. When the milk stopped flowing in that one area, then turn your hand to another area, and that squeezes deep into the breast. It shouldn't hurt, but you're going to feel the squeeze. So keep going, moving your hand regularly so that you're squeezing on a different area of breast until the milk stops. And you may need to swap hands so you can get to every bit of your breast. Also, your wrist will get tired. So that's how to hand express milk.
If breastfeeding is going well, there is no need to express your breast milk, and in the first 2 to 3 weeks it is best not to. Let your baby regulate your milk supply, and both of you get to grips with feeding. Sometimes a midwife or other health professional may suggest that you express, but the reasons for this would always be fully explained and discussed with you. As babies get older, many mums choose to express their milk for the occasional feed. There are many different types of pump available and many brands. The commonest is a hand pump. These are relatively cheap and great for the occasional pumping session. They can be a bit tiring on your hands though. Silicone pumps are relatively new. These are only suitable when milk production is going well, as there is no active pumping. You squeeze the balloon part of the pump and then attach it to your breast. They are ideal for use during a breastfeed on the breast not being fed from. An electric pump is very useful if a mum is pumping most or all of the milk that her baby needs. They are much more expensive to buy, but can be hired. Some of them can be used to express from both breasts at the same time, and this is the most effective and efficient means of pumping. Some women alter an old bra to keep the attachments in place, so they don't need to hold them on. There is no need to make a firm decision about how to feed until you meet your baby after giving birth. But if you think that you would prefer to bottle feed, there are a few things to think about. How about expressing and bottle feeding? Formula is expensive, and a double breast pump would still be cheaper than buying formula for a year, which costs around £700. Any amount of breast milk is beneficial to your baby. Choosing a brand of formula is confusing. There are many different brands on the market, and there is a wide variety of price. All brands are very much the same, and it does not matter which you use or if you change brands. Formula manufacturers would like you to think that you must stick with the same brand, but there is actually no need. Newborn babies must have newborn milk or first milk for the first year of their life. They should not have hungry baby or follow-on milk. You can buy formula in a pre-mixed liquid form or as a powder, which needs to be made up into liquid with water. Formula is an excellent growing medium for bacteria, and bottle-fed babies are 5 times more likely to go to hospital with an upset tummy, so cleanliness and sterility around feeding is essential. Only make up one feed at a time, just before feeding your baby, and throw away any spare formula at the end of the feed. Always hold your baby close for feeds and feed responsively. I'll explain a bit more about this shortly. Warwick Hospital does not supply formula. If you plan to give birth in hospital and to formula feed, you need to take pre-mixed bottles and teats with you. You need the type where the teat screws straight onto the bottle and each bottle is enough for one feed. If a midwife or doctor advise that your baby needs some formula for a medical reason, this will be provided, so there is no need to take some just in case. These suggestions about the way that you hold your baby to bottle feed your baby are known as responsive bottle feeding. They are designed to simulate some of the closeness that is essential with breastfeeding. You have to hold your baby close to breastfeed, but bottle feeding can be done in a much more removed way. That closeness, comfort and love that is essential with breastfeeding is very important for helping babies' brains develop. And you can simulate this with bottle feeding. So always try and have your first feed with your baby skin to skin. And whenever it's practical, feed your baby skin to skin, because that will give your baby a great rush of oxytocin and that helps their brains to develop. Always hold your baby close to feed and swap sides. That swapping sides also stimulates the brain and helps it develop. Make eye contact with your baby during a feed. Chat to your baby. Make it fun. Engage. Feed your baby when they display feeding cues. So that's when they're rolling their eyes, waving their hands around or sucking them. And rooting. Rooting is when they turn their cheek to something touching their cheek and try and suck on it. Offer your baby the teat and gently invite them to take it rather than trying to push it into their mouth. Let your baby stop a feed when they've had enough or if they need a break. One of the problems with bottle feeding is babies are more prone to being overweight. So don't push your baby to have too much milk. If they're showing signs that they're full, let them stop, it's fine. However, if there's any concern that your baby isn't gaining weight enough, that might be different, but the midwife would talk to you about that. Ideally, mum should do most of the feeds because it's essential that babies have one person that they really connect with. Partners can do feeds too, of course, but predominantly it should be mum, and it should, wherever possible, always be one of the parents that feeds the baby. Your baby needs to connect primarily with their parents. Grandparents, aunts, uncles and friends, they can connect with the baby later. And let your baby take breaks in feeds. Don't make them take the whole lot in one go. Give them a break, maybe a burp and a bit of winding. Some babies need to be winded at the end of a feed, especially if they're bottle fed. Breastfed babies are less likely to need to be winded, and if your baby comes off the breast and is sleepy and content, then just put them down and let them sleep. Hold them in one of the positions shown in these photos. If you're using the sitting on the knee position, you can rock them back and forth between your hands, and that will often do the job. Aim to have your baby's back fairly stretched, and you can try patting them on the back, and that should give you quite a hollow sound, or rubbing them on the back. You're aiming to get a burp, and once your baby is burped, that's probably enough and you can put them down and let them sleep. Sometimes babies are very reluctant to burp or they don't need to be winded, so if it's taking ages and you're not getting a burp, they may not need it. So if they'll go down in their cot or in their crib, that's fine, so long as they don't seem uncomfortable. With bottle-fed babies, it's a good idea to break the feed every 10 minutes or so and do some winding and see if you can get them to burp, because that will make it easier to wind them at the end and they're less likely to be sick. Most parents worry about keeping their baby safe and about the risk of cot death. There are many things that you can do to protect your baby from this risk. One of the most important ones is always lying your baby on their back. This alone will protect your baby enormously. When the advice changed about 30 years ago to lie babies on their back, the rate of cot death dropped by about 70% almost immediately. That's an incredibly high reduction, so it really does make a difference to lie your baby on their back. Always put their feet to the bottom of the cot so they can't wriggle down underneath the blankets. Another significant danger is overheating, so they mustn't be able to get underneath their blankets. Assess how many blankets that they need by how their body feels. Put your hand on your baby's chest or the back of their neck and see how warm they feel. They should feel warm to touch, but not hot and not cool. If your baby feels cool, add another blanket. If they feel hot, take one away, and they never need a hat in the house. Your baby should sleep in the same room as you for the first 6 months. Being in another room with a baby monitor is not the same. They should sleep in the same room as you beside your bed. Your baby needs a clean, firm, new mattress. You may be given a cot, and that's fine, but you should always buy a new mattress. Breastfeeding significantly protects your baby from cot death. Many fewer babies that are breastfed die of cot death than babies that are bottle fed. If you smoke or drink, that increases your baby's risk too. So try and give up smoking and avoid alcohol. If you do smoke, make sure you smoke outside of the house and you wash your hands when you come in, and maybe keep a coat or a jacket that you wear for smoking and don't bring that into the house. Try and keep the room that your baby sleeps in between 18 and 20 degrees. If you're sitting down in the evening, you may want the sitting room a little warmer, but the room your baby sleeps in should be quite cool at 18 to 20 degrees. Never sleep on a sofa with your baby. This is a really significant risk factor. Sometimes people will come downstairs at night with their babies so their partner can sleep, sit on the sofa, turn on the television and fall asleep holding their baby. And this is very, very dangerous, especially if you're a smoker or you've had any alcohol to drink. If you want to sleep with your baby, so that means have your baby in bed with you, you must never do this if you smoke or you've drunk any alcohol or taken any medication or drugs might make you sleepy, or if you're very tired. I showed you the video of how to feed your baby at night in bed. This is okay, but try and avoid falling asleep with your baby beside you. Put your baby back in their cot beside your bed when they've finished feeding. For more information, have a look at the Lullaby Trust website and also the UNICEF website and search on there for caring for your baby at night. If you are ever at all worried that your baby is unwell, please call us at any time of the day or night. After your baby is born, you will be given phone numbers of who to call at any particular time. Things that you should worry about are your baby being reluctant to feed, sleepy, listless or floppy. That means your baby isn't waking to feed or is going very long periods of time between feeds, and then if you wake them to feed, they're not interested. Also, your baby not doing as many wet or dirty nappies as they should. I talked a bit about this earlier, but by about day 7, they should be doing 6 or 7 wees a day and at least 2 poos the size of a £2 coin. If they're not doing that many, let us know. Some babies get something called jaundice. This is when their skin goes yellow, and if you look at the photograph on this slide, you can see that this baby has jaundice. He looks as though he's got a great suntan, but actually he's jaundiced. It looks quite yellow. So in a jaundiced baby, the skin turns yellow and sometimes the eyes turn yellow. Some jaundice is just a normal response to birth. So babies in the womb have more red blood cells than they need once they're born, and they have to break these down. Many babies do this without it being visible, but it's visible in some babies. especially if they've had a traumatic birth and have bruising, or if they're very small or premature. If you think your baby is jaundice and you're not due to see us that day, please call us and let us know. We will want to know how well your baby is feeding and how many wet and dirty nappies they are having. Some babies will get rashes as well. The most common of these is a very normal rash that is nothing to worry about, and it looks a bit like a nettle rash. It often moves around the body, so it will start off in one place and then a few hours later it will be somewhere else or have gone altogether. If you're not sure what sort of rash your baby has, or you want to talk to a midwife about it, please call us at any time. And if your baby has white-headed spots or blisters, you must call us straight away. If you're ever in any doubt of whether or not you should call us about something you're worried about, just call us. We're very happy to speak to you at any time. You may worry that your baby isn't warm enough or is too warm. To assess your baby's temperature, put your hand on their chest or on the back of their neck. Your baby should feel as your body feels when you are at the right temperature. If this is hard to feel on yourself, try feeling your partner and then comparing them to your baby. Try not to get too reliant on using a thermometer to check your baby's temperature. Obviously, if you think your baby is ill, use a thermometer to check they haven't got a high temperature. Anything over 37.5 degrees is too high. If you think your baby is too warm, then take some clothes off or take some blankets off. If you think they are too cool, then put some more clothes or blankets on. Your baby doesn't need a hat in the house, and they are safer to be a little cooler than hotter once they are a few days old. If the weather is very hot, then it is fine for your baby to wear very few clothes or even only a nappy. Having a baby is a huge life change. If it is your first baby, you probably go from being fairly responsibility-free, able to do what you want when you want, to being totally responsible for a tiny human who relies on you for absolutely everything, 24 hours a day, 7 days a week. And that is a massive life transition, however much you love and want your baby. Often in the first few days, new parents feel really euphoric, happy, excited, everything's brilliant. Around day 3, mums in particular get what we call the baby blues. They cry for no apparent reason and are generally weepy and emotional. They may be a bit irritable or touchy, feel generally low or anxious and restless. This is completely normal and only lasts a few days. It is usually due to hormonal changes. If it goes on for more than a few days, then possibly it's going into what we call postnatal depression. Postnatal depression doesn't necessarily start just after birth. It can start any time within a year of having a baby. So if you feel depressed, overwhelmed, excessively anxious or moody, start cleaning obsessively, or have any mood-related problems, please speak to your midwife if you are still seeing her, or your health visitor or your GP. Postnatal depression is incredibly common, and it's nothing to be ashamed or embarrassed about. It is very treatable. Sometimes women take antidepressants, and they are really helpful. Others may have counselling or other talking therapy, or a combination of both. Partners can find becoming parents challenging too. They can also suffer from postnatal depression. Watching the person that you love going through labour can be upsetting or traumatic, and becoming a parent is a huge transition whether or not you have given birth. If partners feel down, depressed, are having flashbacks about watching the birth, or are struggling in any way, please talk to someone. Your GP or health visitor is probably the best place to start with. There is lots of support available for difficult postnatal feelings. The NHS website is great. Locally there is a charity called By Your Side, which was set up by a mum in Warwick who suffered from postnatal depression. They have a Facebook page called By Your Side, so just do a Facebook search for them. That's By Your Side. So if you are feeling down, depressed, overwhelmed, or just finding life really hard, please talk to someone, reach out, and help is there for you. Don't bottle it up. I highly recommend that you watch the film Perinatal Positivity on the Perinatal Positivity website. I'll post the link alongside the video. It talks about mental health problems that can happen during pregnancy and after the birth of the baby, for both mums and dads. It's quite a difficult watch. It can be upsetting, but it's full of very hopeful messages about how to manage, ways you can help yourself, and how to access help from other resources. It is normal to get some vaginal bleeding after you give birth to your baby. This will be the same whether or not you have a vaginal birth or a caesarean section. It is quite heavy in the first 24 hours and then should get steadily less. It will start out bright red and then will go dark red, and then it may go brown or pink. If you get any clots, please ring the hospital and have a word with one of the midwives and just explain what the clot is like. Often your bleeding will get less after you have a clot, and that is reassuring, but we would still like to hear about any clots you have, so give us a call. The bleeding can last for a few weeks, and it may reduce and then get slightly heavier again if you are very active. So long as it's not excessively heavy, don't worry too much. You will need lots of sanitary towels. You can use maternity towels or sanitary towels, and some people like to use incontinence pads because they're extra absorbent. After a vaginal birth, it is very common to have some stitches in your perineum. Keep these clean by washing yourself with water after you go to the toilet. Change your pads regularly. With caesarean section stitches, you will have a dressing over these which will be taken off maybe when your baby is a week old with one type of dressing. A simpler dressing will come off after 24 or 48 hours. Just wash your wound as normal, but don't put any soap on it. If the pain gets worse in your stitches, speak to one of the midwives because we would want to check that you weren't getting an infection. Take regular pain relief. It's really important that you're comfortable because it's important that you can move around. Take paracetamol every 6 hours. Take 2 tablets every 6 hours. You can take ibuprofen at the same time. You take that every 8 hours. And you would take 400 milligrams every 8 hours. Some ibuprofen tablets are 400 milligrams and some tablets are 200 milligrams, so check what you've got. It's worth getting some to have at home before you have your baby, so you've got a good supply. If you have a caesarean section, you will probably be given some liquid morphine to take alongside the ibuprofen and paracetamol. And that's a top-up pain relief, so you take it when you need it. But take the ibuprofen and paracetamol regularly because they will keep a lid on your pain, which makes it more manageable, and then you can move around. Try to start pelvic floor exercises as soon as possible after you give birth to your baby. This might be quite difficult at first if your perineum is sore, but try and do it anyway just to set the intention of doing it, even if you can't feel what you're doing. To do your pelvic floor exercises, squeeze between your legs as though you're trying to stop yourself going to the toilet, but don't do it while you're going to the toilet. So squeeze and hold for the count of 10 if you can, and then relax for the count of 10. Try and do this 10 times, 3 times a day. This will help your pelvic floor recover from giving birth and reduce your chances of having any incontinence when you're older or even soon. As you feel ready, you can move around more. If you've had a straightforward birth, you can start gentle exercise as soon as you feel up to it. If you feel like it, go out for a walk. Your baby will be fine so long as they're warm and wrapped up and either in a pram or in a sling. You can take your baby out as soon as you feel ready. Having a new baby is wonderful and exciting. It is often a magical time, but it can be challenging and frightening too. Babies like to be cuddled a lot and held close, but we advise that your baby should not sleep in bed with you. How are you supposed to get any sleep? This can be a real puzzle for new parents. Here's a few ideas for things that might help. Always change your baby's nappy after a feed. They hate having their nappy changed and get very distressed sometimes. When they are upset, they are much less likely to settle for a feed, so if they show feeding cues, just feed them straight away and worry about the nappy later. For mums, breastfeeding is usually their default way of soothing, calming and connecting with their babies. Dads have to try other methods, and these are also useful for mums if your baby is too upset to feed. Letting your baby suck your finger is also a great way of calming them down and preparing to feed, especially if there is a bit of expressed breast milk on your finger. Have the padded tip of your finger uppermost and right inside your baby's mouth against the hard palate. Having a cuddle skin to skin is also a really good way of calming your baby, and talking to them, rock them, or take them for a walk or even a drive. Often if you calm your baby down, then they will settle to feed. Babies do not like silence, so they are often more unsettled at night. In your womb, there is constant motion and noise. If they are born in hospital, this too is a constantly noisy environment. Their first night at home is usually their first experience of silence. Make sure your baby's crib is right next to mum's side of the bed. When you put your baby down in the crib, talk to them, stroke them, reassure them that you're still there. If they won't settle, pick them up, give them a cuddle, feed them, and maybe you and your partner take it in turns to cuddle the baby or to go to sleep. You don't both need to be awake all night. Take it in turns. New parents really worry about sleep. You may find that you don't need quite as much sleep as you used to. Sleep when your baby sleeps and try and let go of your old sleeping pattern. It won't be the same once your baby is born. Try to enjoy these magical early days of your life with your baby. They are very precious and don't last long. Carrying your baby in a sling, also known as baby wearing, allows you to be hands-free while keeping your baby close. They are soothed by the constant motion and being able to hear the carrier's heartbeat. There is evidence that babies who are worn are more settled and cry less. Breastfeeding is easier and mums have a lower chance of suffering from postnatal depression. There are a few safety rules that are summed up with the TICS acronym. Your baby should be tight, in view at all times, close enough to kiss, keep your baby's chin off your chest, and support your baby's back. Your lives will change once you become parents. Before their first baby arrives, most people have few responsibilities and they can usually do what they want when they want. This can take a bit of getting used to, however much you want and love your baby and being parents. Make sure you take time for yourselves and each other. Talk to each other and make time for each other. As I have already said, take it in turns to sleep, and if one of you needs a break, try to be understanding about that. Be kind to each other. Try and avoid staying at home all the time. You and your baby can go out as soon as you feel ready. Your baby will be wrapped up warm and will be fine. A walk and some fresh air are very medicinal. Your sex life will probably change. Women should not have sex after they give birth until they have stopped bleeding and really feel like it. The desire to have sex can take quite a while to come back for some people. Try to find other ways to be intimate, such as cuddles and mutual care and support. Remember that when you do feel like having sex again, you will be fertile, so remember to use contraception. The need for social distancing because of COVID-19 has meant that we have changed how often we see you after your baby is born, but we will keep in very close touch with you by phone, and if we need to see you because you're having some problems, we will see you. We always see you when your baby is 5 days old, to weigh your baby, and your baby may have lost a little weight from birth, and that's okay so long as it's not too much and your baby is otherwise well. And we will also do a blood test on your baby to check for various diseases. There are a cluster of metabolic diseases that are all treated with special diets, and also underactive thyroid gland, sickle cell anemia and cystic fibrosis. We do this test by doing a little prick in baby's heel and then dropping blood onto a card. We send the card off to a lab in Birmingham, and you will get a letter within 2 weeks telling you the result, if it's normal. If there's a problem with the result, then you will get a phone call much more quickly. Problems are most commonly very straightforward problems with the sample, so don't panic too much if somebody rings you and tells you it needs to be done again. We will keep in touch with you, and you will be under our care as midwives for at least 10 days. And when everything is fine and we are happy that you and your baby are thriving and your baby is back to birth weight, we will discharge you to the care of the health visitors. The health visitors will keep in touch with you until your baby is ready to go to school, and will offer you appointments at baby clinics and tell you about your baby's vaccinations. In a moment, you will hear a lovely relaxation session recorded for us by Marie Ashford. Relaxation is a very useful tool to help with anxiety, worries, and just difficult things happening in your life. It's also very useful in pregnancy, going through labour and birth, and when you're living with a newborn baby. And of course, in these anxious times dealing with the COVID-19 pandemic, doing a relaxation session every day will really help any worries you have about that. It lasts about 8 minutes. I'd really encourage you to listen to it all the way through and follow the instructions.
When you're ready, let your eyes gently close and start to focus on your breathing. Breathing easily and comfortably. Noticing the air coming in through your nose and out through your nose or mouth. Just letting your breath come and go as it naturally does. Breathing in and breathing out without trying to change anything. Maybe noticing where in your body you feel your breath the most. Perhaps in your nose or your throat, or your chest, or your belly. Just keeping as much of your focus as you can on your breath. And if your mind starts to wander, as it will, acknowledge those thoughts and then gently bring your focus back to your breathing. Allowing any sounds around you to help you feel safe. allowing those sounds to help you relax a little more. Now take a couple of deep breaths, slowly filling your lungs with fresh air, and as you slowly exhale, you relax more and more. With each breath, relaxing more and more. Imagine you can breathe in peace and calm. Imagine you breathe out tension and worries. Breathing in peace and calm. Breathing out tension. Just letting your breath come and go naturally. Maybe noticing the way your abdomen gently rises as you take a breath in and deflates with each out breath. Abdomen gently rising as you take a breath in, and as you exhale, imagine the breath drifting down through your body, down through your legs and out through your feet. As you exhale, you direct your breath all the way down through your body, down through your legs and out through your feet. With each out breath, relaxing more into the chair, allowing your body to feel a little heavier. And now, maybe noticing the slight pauses between an in-breath and the following out-breath. And between an out-breath and the following in-breath. Just being aware of those slight pauses. Or if you prefer, focus on a place in your body where you find the sensations of breath most vivid and distinct. Allow each breath to relax you more and more. As you continue to breathe in peace and calm, and to breathe out tension from your body. Softening the muscles in your face, relaxing your shoulders. Allow your shoulders to drift down into the rest of your body. And if your mind begins to wander, acknowledging those thoughts and gently bringing your focus back to your breathing. Breathing easily and comfortably. Now, in a moment, it's going to be time to finish this relaxation. So start to focus more on your in-breath and imagine drawing energy into your body. Starting to become more aware of the sounds around you. Moving your legs and feet. Moving arms and hands. And when you're ready, opening your eyes to feel awake and refreshed.
I hope you found this useful. I'm so sorry that we've had to cancel the group sessions for the time being because of COVID-19, but I'm sure you understand why, given the advice about social distancing. I know what's going on with COVID-19 is horrible and really frightening, but you're having a baby and that's really exciting, and it's still really exciting even with what's going on. We will do our best at South Warwickshire Foundation Trust to make sure that your experience is still really good and a really happy one. Remember that you are the parents of your baby, and what you want and how you want to raise your baby is how you should raise your baby. The advice about safe sleeping is really important, but beyond that, do what works for you. Try things, see what happens, work it out. It'll be fine. You'll be fantastic parents. Good luck, and I hope it goes really well for you.